But the reason why I'm here, it's also because, I mean, apart from ECHO being part of the SAG, of the GNC, until last year, in this period, I was with the GNC ECT. So I've been working on coordination, but I've also supported the GNC for drafting the preparedness guidance, which we issued in the spring of 2020. Why a side event on EPNR? Let me give a bit of background. Over the last few years, or even decades, as you know, the humanitarian agenda policies have more and more focused toward resilience, prevention, to avoid the never-ending cycle of short-term emergency response. Just to mention a few high-level events or initiatives, the Sendai framework for DRR, the Sustainable Development Goals for 2030, and the World Humanitarian Summit. But as you know, especially people in the field, the implementation of those commitments and ideas has been slow, has been difficult, as we are taken by our day-to-day, we are busy with our day-to-day work on emergency response. So the GNC has identified this as a priority in terms of support to countries, and has committed to work more. So that's why we developed the guidelines, of which Bryony will talk in a few minutes. Moreover, you may have heard last week saying that the GNC supports nutrition coordination before, during, and after emergencies, which is self-explanatory in terms of when we have to work on nutrition. It's not just during or after emergencies, of course, but we have to prepare for those. Next slide, please. So today will be, this is the session outline. We'll be talking about, first will be Bryony Stevens, who is the GNC Help Desk for Coordination. She'll be talking about the EPNR approach. She will update us on the GNC ERP rollout plan for this year, and also take us through all the resources made available by the GNC for preparedness. Then we'll have a case study from Myanmar presented by Faith, where she also explained how they have used some of those tools in the field. And we will have finally a session on question and answers. So it should take us until 1:50 in Jakarta, still 45 minutes. So please mute your mic if you haven't done so. The session is being recorded. And I think I can give the floor to Bryony now for the next session. Over to you, Bryony. Thanks.
Thanks very much, David, and good afternoon, everybody. So just echoing David, many thanks for joining today's event on emergency response preparedness. We do apologize for some of the glitches in terms of the meeting link, but I think that the issue is now sorted out. So thanks to everyone. So as shared by David, the purpose of today's event is to share with you the GNC's plans to better support country coordination mechanisms with emergency response preparedness. Before we do this, however, we will briefly provide a bit of background on the ERP approach, why the GNC has adopted this approach, and what the approach entails. So many of you are likely familiar with the ERP approach, either through actions at a interagency level, cluster, or organizational level. To clarify, there are three interconnected levels of the ERP approach, and the approach that can be led at any one of these three levels. So these levels include the interagency level, the sector or cluster level, and the organizational specific level. Usually the ERP approach is led at an interagency level, so where OCHA is present, they would lead this process. The interagency level of action, so this builds the overarching framework to guide the collective action of all potential humanitarian responders, The sectoral level defines how agencies will work together to achieve sector-specific objectives, and the organisational level describes how the organisation's response will be delivered. So like the HNO and HRP process, each cluster is to contribute towards the OCHA-led process and has their own unique role. However, unlike the HNO and HRP process, there is more flexibility in terms of the processes behind the ERP approach. So for example, preparedness may not be a priority of OCHA and therefore not initiated by OCHA, or the interagency preparedness exercise may not adequately address nutrition. So in these contexts, the nutrition cluster or sector may decide to conduct its own ERP exercise. So all this said, it's just important to keep in mind that governments hold the primary responsibility for providing humanitarian assistance to women, girls, boys, men and subgroups of the population in need. The ERP outlines how the international humanitarian community can organise itself to support and complement national action. So what exactly is the ERP approach? So for those that may be new to this methodology, the Interagency Standing Committee ERP approach is the preferred preparedness methodology used by the international community to address preparedness in contexts. Or context vulnerable to fragility. It focuses narrowly on the response side of preparedness by ensuring that the humanitarian community is ready to respond effectively and appropriately in anticipation of and in the immediate aftermath of a crisis. So this usually refers to the first 4 to 6 weeks. So the process is continuous and can be divided into 3 key elements. So the diagram on this slide, this illustrates the process and key elements, which include the risk analysis, the preparedness actions, and the contingency planning. So in terms of alignment with the humanitarian program cycle, the risk analysis and monitoring is integrated into the HNO process. And when it comes to the anticipatory actions and readiness, these are usually incorporated into the humanitarian response plan, unless a moderate or high risk is identified outside of the scope of the HRP. So when moderate or high risks are identified outside of the scope of the HNO and HRP process, a separate contingency plan should be ideally developed and preparedness actions prioritised through a work plan. So we will now discuss each of these 3 elements in a little bit more detail over the coming slides. So the first element of the ERP approach is the risk analysis to identify humanitarian risks. Drawing as far as possible from a wide range of expertise from aid agencies, national institutions, organisations, and independent experts. A clear and common understanding of the risks a country faces is fundamental to the entire ERP process. The risk analysis process identifies the hazards that could trigger a crisis and ranks them by impact and likelihood. So risks identified as medium and high will require action under step 2 of the ERP approach, and this is the contingency planning. This step also underpins step 3 of the ERP approach, which is to identify and implement the preparedness actions. So this aligns with the decision-making step on the diagram presented on the slide, just on the right-hand side. So usually the risk analysis is conducted at an interagency level. However, if the ERP approach is being led at a cluster or sector level, the cluster or sector may choose to either use the inter-cluster level risk analysis or conduct the process at a cluster or sector level. In terms of monitoring, so monitoring provides early warning of emerging risks, which in turn allows for early action. Risk monitoring should be indicator-based and follow a regular structured process. A limited number of triggers, indicators, and other information should be agreed to monitor anticipated changes, assumptions made, and also to fill the gaps. So each risk in the ERP risk profile should be assigned a set of indicators with at least one person or entity tasked with monitoring the indicators for each hazard. Indicators should be checked on a scheduled basis, and the timing will depend on the availability of new information, the nature of the hazard being monitored, as well as the trend of the risk. So the second element of the ERP approach is the contingency planning. So for every risk identified as medium or high, theoretically, a contingency plan is required. However, this is set up. This is really up to the coordination team to decide whether a contingency plan is required for the identified risks. As we know, a contingency plan is essentially a snapshot of humanitarian partners' capacities and approaches to meet the immediate needs of affected communities during the first 4 to 6 weeks of the response. The step-by-step contingency planning process will support country teams to identify what preparedness actions to focus on through identifying the needs and the readiness actions. The last step of the ERP approach refers to the preparedness actions. So this step of the ERP approach is dependent on the assessed risk of the country. So medium to high risk countries implement a basket of what we call minimum preparedness actions and advanced preparedness actions to advance a HCT or cluster to respond to specific risks. Whereas the low risk countries implement the minimum preparedness actions. So this is at a minimum. This said, most, if not all, countries supported by the GNC fall into the category of medium to high risk. Thus, a basket of both the MPAs and APAs are required. This is also why we often refer to the APAs and MPAs as preparedness actions without actually defining the two. So we will now discuss the status of the GNC ERP rollout plan. So this will just be over the next few slides. Then after that, we'll discuss some of the support which is being provided by the GNC. So I recognise that this slide might be a little bit difficult to see, but don't focus on the text, but really focus on the colour instead. So in terms of background, the ERP rollout plan was developed based on a global level review of the 2020 CCPM exercise. This exercise analysed the reports of 21 countries which completed this exercise. So this identified common themes across countries. And just thank you to all of those countries and colleagues that participated in this exercise. So I do recognise that this slide is a little bit difficult to read, but what we're trying to highlight here is the themes that can be identified through this global level analysis. So you can see the greens, the yellows, and the reds. So emergency preparedness was identified as an area that required additional support, particularly as emergencies are increasing in frequency, magnitude, and duration due to various vulnerabilities. So to address this, the GNC made emergency preparedness a global level GNC operational support team priority for 2021, and the GNC ERP rollout plan was developed. So this slide here illustrates the GNC ERP process overview. Under each step is a series of actions which are detailed in a more comprehensive ERP process outline document. We aren't sharing it here just because the document is quite detailed, but if it is of interest, please reach out and we can share that document with you. But in summary, step 1 here refers to the development and dissemination of ERP guidance by the GNC to country-level coordination mechanisms. Examples of this guidance include a global-level webinar conducted in Q1 of this year. This was conducted in English, French, and Spanish, and the development of the online GNC ERP tools, which support with generating the ERP plans. Also creating visual ERP dashboards, as well as mapping all ERP-related outputs globally. And a workshop package was also developed, and this was based on the three elements of the ERP process, as well as a checklist which details other actions required to support with the process. So step 2 refers to the first phase of the development of country-level ERP plans by countries with large-scale humanitarian emergencies. So in total, 7 countries were pre-selected for phase 1 of the rollout plan, and an additional 3 expressed interest to participate in the first phase. So these countries include, and thank you to each of these countries, Afghanistan, Bangladesh, DRC, Ethiopia, Myanmar, Niger, Somalia, and let me just see, okay, sorry. Something just reset on my computer, and here we go. South Sudan and Yemen. So all countries have had bilateral support calls with the GNC to discuss the preparation required to complete the process, and an orientation on the new guidance developed by the GNC, including the workshop package and the online tools. So as seen with other exercises, all countries are at different stages of this process, and only one country has completed the process to date, and we will hear from that country shortly. Step 2. So step 2 also includes the ERP Lessons Learned workshop. This workshop will include all countries that participated in the first phase of the ERP rollout, and all tools will then be updated prior to the implementation of step 3. And they will be updated based on the feedback received through the Lessons Learned workshop, or bilaterally with countries that participated in step 2. So step 3 consists of the second phase of the ERP rollout plan and includes all countries with an activated HPC, as well as other countries identified as at risk of fragility. All countries included in step 3 will receive GNC support to develop ERP plans. Step 3 also includes the global level mapping of ERP related outputs, ongoing monitoring and updating of plans based on changing contexts. So this slide here illustrates the various steps and outputs of the ERP approach at a country level. As you can see, at a country level, there are 4 main steps to the exercise, with each step resulting in an output. These outputs are then uploaded to the GNC ERP platform for country-level preparedness dashboards, mapping of preparedness actions at a global level, and also for the generation of the ERP plans, which can then be saved, printed, and shared at a country level as needed. In addition, there is, of course, the required planning and decision-making on the implementation process for each of these steps. So for step 2 of the ERP rollout, the GNC has already and does organise the bilateral support calls with each of the countries to discuss the planning and preparedness for each of the steps. So this will also be extended to all other countries which participate in this process as well. So we've now come to the third section of this event, and we'll now discuss some of the available support and resources from the GNC. So while we recognise that there is more that we need to do, the GNC has been actively working to develop guidance to better support country coordination teams. A key guidance document is the one illustrated on this slide, the GNC ERP Guidance document. This was published in 2020. And this nutrition cluster or sector specific document aligns with the IASC 2015 guidance and provides detailed guidance on each of the three elements of the ERP approach, particularly around the preparedness actions, including the development of a preparedness actions work plan. As raised last week as well during the annual meeting by the Preparedness Working Group, this document will be updated to take into consideration the new IASC 2020 guidance, which will likely be published this year. So the GNC has also conducted the three webinars on the ERP approach in Spanish, English, and French. These webinars targeted country-level cluster or sector coordinators, and over 90 people joined from across the various regions. So these recordings are currently available on the GNC website if of interest. Also, the GNC has developed the ERP workshop package to support coordination teams with implementing the ERP process. This workshop package is designed in such a way that key ERP elements can be addressed separately to allow building on work that may have already been undertaken at a country level. This workshop package includes over 15 different PowerPoints, group work activities, and other supporting resources, such as checklists and templates. Just to flag, though, that this workshop package is still in its infancy and will be fine-tuned based on feedback received from countries involved in the first phase of the GNC ERP rollout. So to provide further support to country teams, the GNC has developed a series of online tools which will support with each aspect of the ERP process, and this also includes the risk analysis as well as the generation of the ERP documents, which can be downloaded and printed. These online tools are also linked with the dashboards, which will be visualized on the GNC website, and Faith will take you through these tools as she used these recently in Myanmar and share her experiences with them. So also the GNC and Radar UK have developed a series of e-learning modules, and two of these e-learning modules specifically focus on the ERP approach and the development of country-level contingency plans. So that's another resource that can be accessed as well for support. And then in terms of ongoing support, the GNC help desks remain available to support throughout the ERP process. If there are country coordination teams, partners, or other actors currently on this event that would like more information on the process, please feel most welcome to reach out to myself, Angeline, or Caroline for more information on this process. And then regarding the next steps, the GNC will continue to work closely with countries in the first phase of the rollout, as well as conduct the lessons learned workshop, conduct a regional level ERP trainings, and update the GNC guidance based on the new IASC 2020 guidance. After these steps, the GNC will then roll out to all other fragile contexts and other contexts vulnerable to fragility. So thank you very much, everyone, and I'll now hand over to Faith. Over to you, Faith.
Thank you, Bryony, and good morning, good afternoon to everyone. My name is Fredzioka, Nutrition Cluster Coordinator Rapid Response Team with the GNC, and I'm currently on deployment to Myanmar nutrition sector. In the next 10 minutes, I will share with you the Myanmar nutrition sector experience on ERP planning process in 2021. Brian, you can go to the next slide as I give a brief background. So just to give a brief background, Myanmar Nutrition Cluster was established to coordinate humanitarian response during Cyclone Nargis in 2009, which was then later deactivated until today. And now it is a nutrition in emergency working group, also referred to as nutrition sector, under the leadership of UNICEF as cluster agency and the Minister of Health. I hope you can hear me well. Okay, so we are all aware of the current political situation in Myanmar following the events of 1st February 2021, whereby the military, Myanmar military seized control over the government just weeks after the issuance of one Myanmar humanitarian response plan. And this situation has plugged the country into a crisis which continues to expand and deepen pre-existing vulnerabilities and pushing a growing number of people into situations of humanitarian need. And in this regard, with the support from the GNC coordination team, Myanmar nutrition sector organized a workshop in first week of April to kickstart the emergency response preparedness planning process, which was mainly to mobilize assistance for additional needs for those affected by humanitarian crisis due to various hazards in different parts of the country, and not including the humanitarian response plan in 2021. So Myanmar nutrition sector being the first country to use the GNC emergency response preparedness planning guidelines and tools, and to go through the whole process as mentioned by Bryony, though the reports are still draft and continue to update as needed. I have some lessons learned to share with you today for learning, as well as feedback to GNC coordination team as they continue to roll out the emergency response preparedness guidelines and tools to other countries. I will walk you through the key components of the ERP process using the GNC ERP online platform on the Myanmar page, and what you are seeing now is a snapshot of the overview page. Here, I would like to first comment on the GNC support to Myanmar on implementation of the ERP process. Our GNC coordination team supported us with planning and facilitating the 3 days workshop in April, and this was very crucial considering the limited capacity of partners on ERP process in Myanmar, and this made the process successful. Again, on the GNC ERP guidelines and tools, which have been provided to support countries on the ERP process, really supported the entire process. For some modifications by the country team was needed. For instance, the online tools can only be used for final reports, but not for coordinating the process among its partners as initially thought. So for Myanmar, I developed and uploaded on the Google Drive some tools which consolidated partners' feedback, and then later uploaded the information online. So important for the GNC coordination team to note that some work on the tools to make them more comprehensive and be able to support countries better may be needed in the coming days. Next slide. Okay, quickly going through the first step on the risk analysis, you realize that we prioritize 3 hazards. 2 hazards, that is armed conflict and floods, were ranked as high risk, and 1, that is COVID-19, ranked as medium risk, and only the 3 were included in the contingency planning. For some partners during the workshop, felt that we needed to consider more hazards, the contingency planning. Working with 3 hazards, which are overlapping in the same geographical locations, is a challenge. And this was especially in determining the overall people in need and key immediate needs across the different hazards. And so we found a way of doing it. It may require the GNC coordination team to review and provide a standard way of doing it across countries. Also to mention that OCHA Myanmar has activated an emergency response preparedness working group with participation of all sectors and clusters. However, the emergency response preparedness processes across the clusters, the sectors, also at the intersector level, are at different stages. For instance, nutrition sector, we were the first to start and go through the entire ERP planning process. And it had using the new Indigenous Standing Committee Guidelines 2020. And that meant lack of common operating data sets, especially on determining the numbers of the expected people affected by the crisis. But one good thing I would like to highlight here is that the ERP report has been very instrumental to feed into ongoing OCHA processes, especially the HRP 2021 revision and the MHF projects, Myanmar Humanitarian Fund projects, because as a sector, we have already agreed on our priority interventions and geographical locations. Next slide. Quickly going through some experience on determining response and operational capacity. The scope of additional needs as a result of the risk analysis and the prioritized key immediate needs, as we've seen in the previous slide. It was an eye opener to the sector on the need to develop partner capacities to scale up response. However, the timing of the ERP and being the first preparedness process to be undertaken by the sector, and when I say timing, here I mean the ERP planning process happened during the peak needs of the armed conflict, when partners were expected to be providing response and not preparing. And this has been the challenge because developing partner capacity for immediate response has been delayed. But the good thing is that during the workshop, the ERP workshop, it was an opportunity for partners to quickly think of some of the immediate actions for getting ready to respond. For instance, the SAG immediately established technical working groups for IMAM, IYCF, and assessments to support partners to be able to quickly operate, scale up, and deliver life-saving nutrition activities in the current context. Next slide. Okay, on the operational delivery, nothing major to highlight here other than to mention that in the response to the effects of armed conflict, some of the interventions listed to have been done in the first 4 weeks have not yet been implemented as per the plan because we needed time after the ERP planning to mobilize resources and the capacities for immediate response. Though response is ongoing, especially where we had established operational presence of partners before the emergency. And to the last slide now. Here we have the financial requirements to implement the priorities established by the Emergency Response Preparedness Planning. And as I said earlier, we are still updating the emergency response reports as new information is received, and also as the newly formed technical working groups continue to coordinate and determine technical support needs accordingly. And also to mention that we have preparedness action work plan, and discussions are ongoing within the sector on accomplishing the key preparedness actions, and the budgets will be updated where necessary in due time. And that is the end of my presentation. Thank you very much. And I'll now take it back to the chair of the day, David. Thank you.
Yeah, thank you very much, Faith, for the presentation. Thank you to Bryony as well. So I think we are on perfect time. Good job. So we'll have a Q&A session now for the GNC coordination team to answer any question. So the floor is open. Whoever wants to ask a question, please feel free. We have another 15 minutes. Come on, don't be shy. Okay, I see a question coming up in the chat. Maybe I'll take note of a bunch of questions and we will have a first round of answers. Well, we'll start with this first one to break the ice. Faith, this one is for you. For Myanmar, how do you work with other sectors for this EPNR? So intersector coordination within the preparedness framework. Over to you.
Okay, thank you for the question. How did we work with other sectors during this emergency response preparedness planning? As I said, we had different stages with other sectors. It's nutrition sector, we are the first to do and complete the ERP process. And what we did, we invited other relevant sectors. I remember we had food security and health cluster coordinators attending the ERP workshop. And also we've been able to present for lessons learned at the ERP technical working group at OCHA level, what we've been able to do for other sectors to learn. And yes, that's what I can say in terms of working with other sectors, because as I said, at different levels in terms of even technical capacities of the same. Yeah, any question for me again?
Thank you, Faith. I don't know who wants to take the second one. It's about the coordination now with the national emergency response systems and plans. So I suppose where plans already exist, how do we coordinate with this system, for preparedness to avoid overlaps? And there is also a reference to the SAN national focal point, whether you use it as an entry point to the national authorities. Who can take this? I don't know, Bryony and Stefano, if it's there on behalf of the GNC.
Sure, thank you, David, and maybe I'll ask Faith just to complement with her experience at a country level. I'm not sure if some colleagues joined late. Again, we do apologise for the glitch with the links, but you might recall at the beginning of the presentation that we raised that the government will also always be the lead in terms of this process. So where possible, we do need to identify what is being done by the government and ensure that they are part of that process. Of course, every context is slightly different. In the context of Myanmar, I'll allow Faith to just share a few words on that. Unfortunately, because of the context there, we were unable to properly involve the government in this process, and that is because of the recent coup. But yeah, just to reiterate that that this process should be done with our respective government counterparts, and other processes do need to be taken into consideration. Perhaps I'll also just raise here as well that if anything has been done already by our government counterparts or by national actors or other, there is no need to duplicate processes. So that's the unique thing about the ERP approach as well. We can use what is already being done or has been done. For example, if a risk analysis has been conducted, we don't need to redo the process. We can just use what has already been done, and then just re-look at that through a nutrition lens if needed. So Faith, perhaps you'd like to just complement that. Over to you.
Yes, just to add that I can see some questions about involvement of the government. For Myanmar, and because of the political situation right now, we are not working with the government other than some of the issues like travel, authorization, MOUs, with the line ministries. That is what we are doing right now. But also we have the how are they calling it? Some, the Minister of Health workers are also involved in the civil disobedience movement. So they are not even available for coordination. But the SAN national focal point person has really been a part of the process, and also because of the health system which has collapsed, there is a lot of strategies being developed right now, and we are working together with the SAN national focal point person. Thank you.
Excellent, thank you, Faith. See, I see most of the questions are around this, coordination with other systems, government, etc. There is also one question more specific on health authorities, so Ministry of Health. Is there anything you want to add on that point, Faith? How was the coordination with health authorities in Myanmar?
As I said, it's very minimal, only very technical. As I said, the health workers, the Minister of Health, they are involved in the, in the civil disobedience movement. Yes, especially like in Rakhine, those who know Myanmar very well, we have the Minister of Health, we have now the issues of watery diarrhea, and we are trying to coordinate, as minimally as possible, especially on the supplies, making sure that the hospitals have the right supplies from the UNICEF and all that. So it's very difficult, okay? And we also have some of the UNICEF staff from Myanmar here who have better information than me. And we have Sajay who is here and wants also to support on this. So maybe if you can allow David, Sajay can come in.
Yes, Sajay, the floor is yours. Over.
Okay, thank you, David, and thank you, Faith, for updating on the ERP process. So especially for engagement with the government counterparts, including Ministry of Health and Sport in Myanmar. So before 1st February 2021, before this political crisis in Myanmar, we were working very closely with the government counterparts, and Director of National Nutrition Center was the co-chair of this nutrition sector working group. In Myanmar, the nutrition sector working group is under Nutrition Promotion Steering Committee, which is chaired by Ministry of Health and Sports. So this is the high-level commitment shown towards the nutrition sector coordination working group, and we were having like biannual meeting with under the chairmanship of Minister of MOHS. But unfortunately, after 1st February incident, most of the MOHS staff, including other line ministries, joined the civil disobedience movement campaign, and in the meantime, United Nations country team also decided not to get engaged with the de facto government authorities. So due to this reason, as we initiated this ERP process in April to address the increased need due to the protest, at the same time ongoing conflict in different parts of country, including civil unrest. So we were not having the engagement with the line ministries. All this process was done together with the NGO, INGO, and other stakeholders. But the good thing is in Myanmar, we have two structures, one for emergency nutrition response, that is the nutrition sector working group. At the same time, we also invited in this 3 days workshop, which was mentioned by Faith. On the last day of the workshop was more focused on intersectoral collaboration, and we had invited the food security sector coordinator, waste sector coordinator, and health sector coordinator, and all of them had joined this meeting and contributed for this ERP process. At the same time, we have a scaling of nutrition, very good structure in Myanmar, and there is some UN network, some business network, and some civil society agency networks. So the members from those some different networks also represented in this meeting. So altogether, in this ERP development process, around 71 members from different NGO, and private sectors had joined. So though we missed the participation contribution from government counterparts, but from other stakeholders there was good participation, and ultimately we managed to develop this ERP, and at the same time we are also implementing for the nutrition response in the context of Myanmar. Over, thank you.
Excellent, thank you very much for this clarification. I think there is another question on Myanmar. ERP information collected for national level or at subnational level as well? Okay, Faith, you replied in the chat. It's both national and subnational level. Good. We have another 2 minutes. I see no hands raised. Is there any other question? Oh, one is coming, maybe. Hold on, I cannot see who is raising the hand.
Antene?
Hi.
Antene? Okay, go ahead, please.
Yeah, no, not to ask a question, but to emphasize on the points which my colleagues made. In terms of engagement with government line ministries, there is no difference than we do normally. We have to work with the government. And the good thing with the ERP process, the system itself is it facilitates engagement with other sectors and with the government, because the risks which we identify, we do not really create a risk or identify hazard or risk for nutrition. We just take a risk which can have impact on different sectors. And usually this hazardous or the hazards which we assess for risk analysis normally affect the different sectors. So which means is that we need to take into consideration in our analysis, in the contingency planning, and in all various stages of the ERP process, the different sectors. And the system, the tools we use, the steps clearly allow for engagement and working with other sectors, including with the government line ministries. And also, just to give a specific example, in Myanmar, it was difficult because of the reasons mentioned by Sanjay and Faith. In Niger, it was actually, I guess, the workshop itself was initiated with the request of government, and the government staff at different levels were involved heavily, and most national partners were also involved. So the participation of the government or national partners, including development partners, it all depends on the context. But in general, the process, the system, the tools allows for inclusive process, which involves various types of partners. Over.
Okay, thank you very much, Antene. I think